Welcome to the 5 on 5. Joining us today is Dr. Diana Spade, here to talk about the Death with Dignity law. Dr. Spade, thanks so much for being here.
Thank you for having me.
For those who aren't familiar, what is the Death with Dignity law?
Okay, Oregon's Death with Dignity law allows terminally ill patients to meet the requirements to get a prescription from their physician to end their life in a painless manner at the time of their choosing.
It's been around since the 90s.
1998.
Okay.
Although the law was passed in 1994, there was some objections to it, so it was put on hold and finally passed in 1998.
And just to expand a little more, there are 5 different qualifications or 5 different steps that you have to be able to pass in order to...
Yes, there are some qualifying requirements. The person has to be an Oregon resident, they have to be at least 18 years of age, and they have to have a terminal diagnosis as certified by 2 physicians, and that would be a diagnosis of 6 months or less. They would have to be deemed competent, and again, the prescribing physicians would evaluate that, and if they needed a psychiatric evaluation, they would request that. And the patient also has to be physically able to take the medicine themselves.
Okay. How many patients have used this law since it became legal?
Since it's been legal in the 17 years, a total of about 991 patients have taken it. However, about 1,500 actually got the prescription, but a good 30 to 40% never use it. It's kind of a relief or something there in case the pain becomes unbearable. Then they can take the medication. But like I said, over 30% don't even take the medication.
Wow. You do a lot of presentations and programs around the area. What's one of the most commonly asked questions during those?
Well, one of the first things that people want to know about is how do I access the law? And of course that is between the person and their physician. They have to ask their physician. Nobody else can ask for them. The physician does not have to cooperate. It's personally, if their choice, if they want to provide the prescription to that patient. It does require 2 physicians that agree that it's a terminal diagnosis. There are some steps you have to go through, ask, and then wait 15 days, and that's kind of a waiting period so the physician knows that that person really wants to pursue this. They have to make that request also in writing and to be signed by 2 witnesses. And then once that's all done, they get the prescription. Have to wait 48 hours after the prescription is written, get it from their pharmacist. They can put it on their shelf, and if and when they ever want to use it, it's there.
And there is a program that is coming up this week. We want to touch on that, but we're going to take a quick break. We'll be right back.
Okay.
Welcome back. Joining us once again is Dr. Diana Spade, here to talk about the Death with Dignity law. Again, Dr. Spade, thank you so much for being here.
Thank you for having me.
You do a lot of programs and presentations, and there's one coming up this week. Talk to us a little bit about what that is.
The presentation coming up this week is sponsored by COHO. That's a local organization choosing options, honoring options, which provides information on all end-of-life choices. And this particular program will be Thursday at the Smullen Center. It's actually 2 times, 2 and at 7. And at that time, myself and 2 other presenters will be discussing Death with Dignity, a compassionate choice, and discuss that a little bit with the audience.
How can people take part? Do they need to register ahead of time? Do they just show up?
Nope, they don't need to register ahead of time. They can come. Like I said, it's at the Smullen Center at 2 and at 7, and the whole community is invited.
Just a way to learn more about the law and how it may apply to a loved one or to themselves.
Yes, and actually it's a series of programs. They've already had a program on how to access palliative care. There'll be another one coming up in a couple of weeks on how to get your advance directives in order. So it's a whole series of program that goes every Thursday for about 5 weeks.
And if someone wants to get more information, if they can't attend this presentation, where can they get more information on this? More information
on Death with Dignity can be obtained from the Compassion and Choices website. That's compassionandchoices.org. It's a non-for-profit organization that I do volunteer for, and it provides information and other source of information on all end-of-life choices, but also on Death with Dignity to anyone that calls up and asks.
And Dr. Spade, is there anything that I didn't touch on that you want to add while I've got you here?
I just might mention that this law has also been passed in Washington State and in Vermont and in California, all based on almost the same qualifications that you need in Oregon.
Okay, so Oregon has kind of been an example for some of the other states.
It was the first, actually not the first that attempted. Actually, Washington was the first attempt that attempted, but we passed it first, and then they followed up in 2008 and Vermont in 2013, and then it will be instigated in California probably in June of this year.
All right. Well, Dr. Spade, thank you so much for your time. We appreciate it.
And thank you for having me.
We'll be right back.